He was a wonderful and calm child. He was developing absolutely normally. When he was 2 years old, he was able to tell you his name and how old is he. On 3 years of age, the only words that he said were, "No, I don't want." He lost the bigger part of his words and became really negative as a behavior. He wouldn't walk by himself. I had to carry him all the time. This was a great shock for each parent because everybody wants his child to be happy, and in a moment you understand that his future is insecure, that he will be all alone and will not be able to build a family. You do not know whether he will be able to go to school. You do not know anything for his future. Hello. I'm sure that all of you were shocked by this story, but the great news is that all these children can be treated. For the first time in Bulgaria, specialists from the United States have come to cure the Bulgarian autistic children and to teach our doctors how to treat their specific needs and problems. They are Dr. Andrew Usman, one of the first specialists in the world that treats autism, and the American pediatric gastroenterologist Professor Arthur Kriegsman, who is now in Tukuda Hospital, Sofia, where he treats children suffering autism. Hello, Gala. I'm now in Tukuda Hospital, Sofia, in the endoscopy sector, where the whole morning the medical team performs endoscopic procedures to the small patients with autism. Just a minute ago, such a procedure was executed, and after a while we'll start the next one. I'm really glad to introduce to you Professor Kriegsman, a pediatric gastroenterologist, and next to him, Dr. Georgi Semyonov, Chief Executive Officer of Tukuda Medical Center and Chief of Anesthesiology and Intensive Care Department at Tukuda Hospital, Sofia. I'm starting immediately with the first question. Dr. Kriegsman, you are one of the first that found a relationship between the specific behavioral characteristics in children with autism and their gastrointestinal problems. What is exactly the relationship? There are a lot more questions than answers. There are a very big frequency of gastrointestinal symptoms in the children suffering autism. Most of these children are suffering diarrhea, constipation, colics, abdominal pain, and abdominal distension. Our goal is, with endoscopy observation and diagnostics, to find the evidences for these symptoms. With the endoscope, we can observe immediately, or with a microscope after the biopsy sample is taken. Exactly how this information is connected with autism, it is a question for the future. We have theories that autism could be a result of gastrointestinal diseases, but that should be confirmed by medical researches and studies. Because we hope that autistic bowel disease will raise questions to the whole medical world, and this world will search for their answers.
Almost all autistic children have gastrointestinal problems. What is the reason for that?
We don't know.
Не знаем.
We do not know. This is a very important question, and I hope the answer is behind the corner. We truly believe that if we understand what is the connection between the diseases of the bowels and autism, and this will be the utmost direction for solving the problem autism.
What are the most frequent findings of the biopsy with autistic children? What do you find in their biopsies?
The most frequent finding is
Най-често установяваме колит.
The most frequent findings are colitis and esophagitis. With the capsule endoscopy and the pill cam, we really frequently find an enteritis as well. So that appears that the most of these children have abnormal changes in the gastrointestinal tract.
Попада в стомашно-чревния тракт.
gastrointestinal tract of these children.
И всички тези случаи наистина има и проявления, някакви отклонения в стомашно-чревния. I have heard that only after you have treated successfully their tummies, these children start behaving normally, they start talking. Don't you see the relation between the two? Getting rid of the gastrointestinal problem and then improving their autistic state?
We know that certainly is that when we treat the gastrointestinal problems, when we treat, for example, the diarrhea and the abdominal pain, the children and everybody, of course, will feel better and they are calmer. And all the therapies, the behavioral therapy, the speech therapy, have better results when the gastrointestinal symptoms are gone. When these children are in pain, they cannot focus and are not able to participate. But when there is a connection between the treatment of the gastrointestinal diseases and the autism, we hope that we or other researchers should look really seriously on this question and for its answers. Let us include in the conversation Dr. Simionov, who is the anesthesiology and intensive care department chief at Tukuda Hospital, Sofia. We heard that this procedure needs a full sedation of the child. Are there any risks because of that, and how the full sedation affects the autistic child? Good morning. Yes, this procedure is obligatory performed under full anesthesia, because sometimes these children cannot collaborate with the doctors. That's why we should do everything possible to secure their safety. The modern anesthesiology techniques and medications provide a safety net. Our hospital is perfectly equipped, and that's why we were chosen by Dr. Kriksman to perform the upper and lower endoscopy in our hospital, and thus helping all the parents and patients suffering from such disease. We consider that not only the specialized facilities, but each of us have to help these people. I would like to hear some words from the mother of Sashko. Yes, in a minute or two will be the procedure of Sashko. Hello, Galia. What are your expectations and do you anticipate a better result? What are your feelings just before the diagnostics? I am sure that we will have good effect, and that is why we are doing it. This is the main reason that my child is walking through all these procedures. I absolutely believe Dr. Kriksman and the whole medical team, knowing that my son is in the best possible hands. I hope that the forthcoming treatment and medications will give the same effect as I have observed in the other children, and after that I will be extremely happy.